Inside the body, toxic stress can behave like a home intruder, trespassing into your physiology to wreak havoc and rob you of energy, protection, and agency. One of the things that I think is so important to realize with toxic stress is that it causes dysregulation. Dysregulation is the impairment in the regulation of your metabolic, physiological, or psychological process. It makes you reactive and easily triggered. It can strain relationships. It can strain work. It can strain the way that you are in the world. It also reduces your window of tolerance. There are significant sex differences when it comes to toxic stress. We know that women experience more stress than men, more toxic stress than men. We also have more trauma. So the level of trauma in the female body is higher than what we see in the male body, especially sexual trauma, sexual violence, and earlier trauma in childhood. We know that people who have adverse childhood experiences have more risk of chronic inflammation and about 45 different chronic diseases. And that includes things you might think of like a higher risk of depression, anxiety, post-traumatic stress disorder. But it also includes physical illnesses like autoimmunity, heart disease, and many other factors. We're wired to have a stressful experience not that often, maybe once a quarter, maybe once a month, max. We're not meant to have them every day or weekly. We're not meant to get an alarm response when we check our emails. So what do we do? Those of us who've got toxic stress, what are some of the things that have been shown to help? Inside the body, toxic stress can behave like a home intruder, trespassing into your body's own physiology to wreak havoc and rob you of energy, protection, and agency. Depending on your vulnerabilities, your exposure to toxic stress can show up in different ways: heart disease, high blood sugar, depression, or even another condition like autoimmunity. While you might think you're fine, that the trauma or the toxic stress that you've experienced isn't a big deal, the body may not agree. Time and again, I see people who disregard their toxic stress, yet their body tells a different story. One of physiologic dysregulation that may persist and even cause disease until the underlying forces are addressed. It was true for my patient, Radha, and it was true for me. Radha, whose name is Sanskrit for devotion, is a 40-something nutritionist and mother of two. She had suffered for years with chronic illness. She had irritable bowel syndrome and fibromyalgia, which involves widespread muscle pain and discomfort, accompanied by fatigue, sleep disruption, poor memory, and mood. Years before, she had a hysterectomy and a partial ovary removal to alleviate chronic pelvic pain from endometriosis, fibroids, and adenomyosis. After these surgeries, she was struggling with perimenopausal symptoms, metabolic syndrome, including prediabetes and abnormal cholesterol levels, fatty liver, and high levels of inflammation. Quick aside about inflammation. Toxic stress can cause inflammation, but what is it? Inflammation is your body's built-in defense and repair system. It's a complex biological response that's designed to protect you from infections, injury, and harmful stimuli. It's an essential survival mechanism. Without it, your wounds wouldn't heal, infections would take over. But there's a catch. When inflammation becomes chronic, persisting at low levels over time, like it does in people with toxic stress, it stops being helpful and it starts contributing to diseases like heart disease, diabetes, and neurodegeneration. In other words, acute inflammation is your ally, but chronic inflammation is the slow-burning party. In other words, acute inflammation is your ally, but chronic inflammation is the slow-burning fire that can silently damage your health. It's like a bad frat party that never ends. So when Radha came to see me, she was desperate for help and answers. She was frustrated that she'd suffered for so long without any true relief. Not only did she have uncomfortable symptoms of fatigue and pain, but she didn't have any answers as to why she struggled with these chronic illnesses. Her previous treatment didn't fix the underlying issue, or it led to other new health problems. It was like a crazy making game of medical whack a mole with no hope in sight. She was tired of it. Here's how she described it. Toxic stress from past experiences became biologically embedded in my anatomy and physiology, where I was swimming in a soup of inflammation and dysregulation. This altered my ability to respond to and rebound from stressors in a healthy way. Most days, I'm pain free. If I allow stress to dysregulate and derail my thoughts and choices, my fibromyalgia and fatigue will peek through the curtains as though to say, "Are you welcoming us back?" And occasionally I surrender to the symptoms because the stressor is overwhelming, like my father's recent death. But most days, I say no and I redirect my thoughts and choices, moving back to pain free, energetic experiences. So, in this podcast, we're talking about toxic stress, how it affects your mental and physical health, how we measure it, and how we address it. One of the things that I think is so important to realize with toxic stress is that it causes dysregulation. Dysregulation. What does that mean? Dysregulation is the impairment in the regulation of your metabolic, physiological, or psychological process. It makes you reactive and easily triggered. It's often from toxic stress, from trauma. It can strain relationships. It can strain work. It can strain the way that you are in the world. It also reduces your window of tolerance and your dynamic range, your biological, emotional, and psychological dynamic range. And so, as we try to unwind toxic stress and dysregulation, what we know that helps is to downregulate the brain's alarm systems, to restore healthy somatic, physiological, and cognitive functioning, and also to help you explore the edges of your window of tolerance without triggering you. There was a study that got my attention, and I want to share it with you because it might be relevant. This was a study that was published in Neurology in 2018. We'll link to it in the show notes. They looked at a total of 2,231 people who were in the Framingham Heart Study, third generation. They did not have dementia. They were basically in middle age. The average age was 48.5, and 53% of them were women. The study was performed at the University of Texas at San Antonio. And they found in this group of people, men and women, that high morning cortisol in the saliva was associated with worse memory and visual perception, lower total occipital and frontal lobar gray matter volumes, lower total cerebral brain volume in women, but not men. And they also saw that there was no effect with the ApoE4 genotype. But what was critical here was that these weren't older people like in their 60s and 70s that had shrinkage of their brain associated with high cortisol, but those who had high cortisol and were female at a mean age of 48, they had shrinkage of their brain and worse memory. So I heard that and I thought, I'm so screwed because I'm someone with high cortisol and it's something that I work with all the time so that I have less of a reaction to toxic stress and I don't carry it in my body. So when you think of toxic stress, another way to consider it is trauma. And trauma is a Greek word for wound. It's an emotional response to a difficult event like an accident or a crime or a natural disaster. Gabor Mate talks about how trauma is not what happens to you, it's what happens inside of you as a result of what happens to you. Bessel van der Kolk, a psychiatrist, says that trauma is not the story of something that happened back then, but the current imprint of that pain, horror, or fear living inside of you. And I feel like we are living in a time where almost none of us hasn't been exposed to trauma or to some form of toxic stress. It's ubiquitous. And one of the things we'll talk about today is post-traumatic stress disorder, which is a condition that includes flashbacks, nightmares, anxiety, hypervigilance, uncontrollable thoughts about an event that you experienced, changes in accurately evaluating threat stimuli. So your ability to process your senses becomes impaired. And you may not relate to having post-traumatic stress disorder, but what I see in my practice is people who have partial PTSD. They have what's called subthreshold PTSD. So maybe they've got the nightmares or the hypervigilance, but they don't have the whole spectrum of the disease. And so I want you to ask that of yourself. Do you have partial PTSD from something that you've experienced? And if so, I hope that this podcast will be helpful to you. So we've got that evidence of women with high cortisol at a mean age of 48.5 who've got shrinkage of their brain as a result of high cortisol. They've got toxic stress and it's impacting their brain. It's impacting their memory. Lisa Mosconi, a researcher at Cornell Medical School, has found something similar. So she published in 2024 that we see memory loss, brain shrinkage, and high beta amyloid load in healthy women who have high cortisol. So she looked at a total of 277 cognitively normal midlife people. And she knew that chronic psychological stress is a risk factor for Alzheimer's disease. So she wanted to see what happens in the people with high cortisol when they're younger, when they're in their 40s and their 50s. She found that higher cortisol was associated with lower total brain volume. So that confirmed the study that was published in Neurology in 2018. She also found that people with high cortisol had lower glucose metabolism. So their ability to use glucose as a fuel in the brain started to falter. It didn't work as well. She also found that there was higher beta amyloid load in the parts of the brain that are vulnerable to Alzheimer's disease. And she definitely found that in women, the cortisol associations were stronger with the amyloid beta load and also with the frontal cortex change in glucose metabolism. And it became much more pronounced after menopause. So overall, she found that these results suggest that there's some sex-specific neurophysiological responses to stress, and it supports a role for stress reduction in Alzheimer's disease prevention. When it comes to toxic stress, the way that I think of it is that we are wired for occasional stress. We're also wired for long periods of activity and time-restricted feeding, but there's a mismatch now between your genetics and your environment, and it's led to more of us experiencing toxic stress and suffering from the consequences of it. We know that biologically, toxic stress can become embedded in the body. It can exhaust the control system for your hormones, which I think of as the hypothalamic, pituitary, adrenal, thyroid. We know that biological embedding of toxic stress can affect a number of different systems in the body. It can affect the control system for your hormones. What is that? I think of that not as just the hypothalamic pituitary adrenal axis, but actually the hypothalamic pituitary adrenal thyroid gonadal gut axis. I know it's a mouthful, but that's what controls your hormone levels. It can also exhaust your pine network, your psychoimmunoneuroendocrine network, and your metabolic networks. We know that certain coping behaviors to toxic stress can cause problems. It can lead to eating disorders, alcohol use disorder, smoking, not sleeping enough, and sedentary behaviors. And that can then compound the maladaptation. There are significant sex differences when it comes to toxic stress. We know that women experience more stress than men, more toxic stress than men. We also have more trauma. So the level of trauma in the female body is higher than what we see in the male body, especially sexual trauma, sexual violence, and earlier trauma in childhood. We know that people who experience adverse childhood experience, we know that people who have adverse childhood experiences have more risk of inflammation problems, chronic inflammation, and about 45 different chronic diseases that they have greater risk for. And that includes things you might think of like a higher risk of depression, anxiety, post-traumatic stress disorder. But it also includes physical illnesses like autoimmunity, heart disease, and many other factors. If you don't know your adverse childhood experience score, I really encourage you to take the questionnaire. We'll link to a free quiz that's in the show notes. We know that people who have elevated adverse childhood experiences scores, high ACE scores, they have a greater risk of problems with diabetes. They have more sensitivity to cortisol, to the main stress hormones. A lot of people don't think about toxic stress and its relationship to metabolic health. And metabolic health, the way I think of it, the way I think of metabolism, is that it's the aggregate of all of the biochemical activity in your body. So it's not just how fast or slow you burn calories, it's all of the ways that you produce energy in the body. And we know that metabolic health is affected by toxic stress. So there was a study with the Centers for Disease Control where they looked at 25 different states to look at the attributable risk of health problems related to adverse childhood experiences. They looked at a total of 144,000 people, so it was a big study. And they found that there was a relationship between adverse childhood experiences and adult onset type 2 diabetes. So overall, they found that in men who had an ACE score that was greater than 4 had a greater risk of diabetes. But in women, they needed an ACE score of greater than 1 to have a greater risk of diabetes. And trauma in women was also associated with smoking and obesity. So we know that early trauma affects your ability to metabolize fatty acids and also your production of steroid hormones, things like cortisol. Toxic stress also affects your gut. It does it in a number of different ways. It can increase intestinal permeability, so-called leaky gut. It's almost like a boundary violation where this boundary that you're meant to have in your gut no longer has the tight junctions that keep the wrong things out and keep the good things in. And instead, you've got increased inflammation as a result of those tight junctions not working properly. Toxic stress can alter your stomach acid and digestion. It can drop something called your secretory IgA, which is like the first line of defense against pathogens, infections that you get exposed to in the gut. It can increase your risk of dysbiosis. And we also think that it can increase the chance of inflammation in your brain because lack of that boundary in your gut can lead to a problem with the boundary in your blood-brain barrier. One of the things that's happened globally is that the Western gut microbiome has become more impoverished. And we know that there's a lot of different factors that contribute to the microbiome, which is the sum total of all the microbes in your gut and their DNA. What are some of the root causes of this? Well, number one, when you're in utero and when you're a baby, your mother's mood and stress level can impact your microbiome. Having a C-section, being born by a C-section versus a vaginal birth can impact your microbiome. Being fed formula versus breast milk can impact your microbiome. Lifestyle factors such as chronic toxic stress, poor sleep, physical inactivity, all of those can adversely affect your microbiome. Your food affects the microbiome. Having more processed and ultra processed food, having nutrient insufficiency, being exposed to preservatives, glyphosate, that can impact your microbiome. And then your environment can impact your microbiome, including your exposure to toxins, medications, alcohol, which causes leaky gut, infections. And as the Western gut microbiome has become more impoverished related to toxic stress, we've seen the rise of immune diseases, autoimmune diseases like Crohn's disease, ulcerative colitis, type 1 diabetes, celiac, multiple sclerosis. What I think about when it comes to toxic stress is how it affects the immune system. It can lead to the immune system not being able to turn off inflammation when it's meant to. And there's a lot of different ways that an immune system that's incorrectly resolved can then map to conditions that you might be facing. Things like mental health problems, long COVID, autoimmunity, metabolic dysfunction, as we talked about, heart disease, joint problems, gut issues, cognitive dysfunction, lung problems, and skin problems. One of the key ways that toxic stress shows up in the body is with autoimmune disease. It's the topic of my latest book, The Autoimmune Cure. And I think it's worthwhile to spend a moment talking about autoimmunity because rates have escalated over the past few decades. And we think it's related to changes in our environment, including toxic stress. So right now, autoimmunity affects about 5% of the world. Women have a much higher risk of developing autoimmune disease. And right now, out of every 5 people, 4 people are women with autoimmune disease. Let me say that again. Women have a much higher incidence and prevalence of autoimmune disease. So right now, if you look at 5 people with autoimmune disease, 4 of them are women. A lot of people don't realize this, but there's a precursor to the development of autoimmune disease. It's called autoimmunity, and it's like a pre-disease state. And when you look at a population of people, somewhere around 18 to 30% of people with no symptoms have antibodies against their own tissues. And we think some part of that is related to toxic stress. One of the things that happens with toxic stress is that it can affect your autonomic nervous system. So what is that? As the name implies, it is some of the automatic parts of your nervous system. It's got a few different parts. There's the sympathetic nervous system, fight, flight, freeze, fawn. And then there's the parasympathetic nervous system, which some people nickname rest and digest, or stay and play, or feed and breed. It's where all the healing happens. And if you're someone who is dysregulated, who has an autonomic nervous system that spends too much time in the sympathetic arm of the autonomic nervous system, that can lead to cardiovascular problems. It can lead to difficulty with gastric motility. It can affect your sleep. There are ways that the autonomic nervous system can show up as a problem under toxic stress with low heart rate variability, the time between each of your heartbeats. It can also lead to a greater risk of autoimmune disease, ischemic stroke, cognitive decline, and cardiovascular disease. Let's see. One of the places where I see toxic stress show up the most, especially for women, is in perimenopause and menopause. It also can show up postpartum, which I think of as a preview of coming attractions in perimenopause. A lot of people think of perimenopause as mostly a hormonal issue, that your estrogen and progesterone is changing. But the truth is, it's much broader and deeper than that. Your immune system is changing, your metabolic system is changing. It's not just estrogen and progesterone. So, one of the things that happens as you transition from premenopause to perimenopause to menopause is that if we just look at glucose metabolism, in premenopause, you might have decreased glucose uptake. You might have decreased glycolysis. But once you hit perimenopause, it gets a little worse. You might find that your glucoses start to climb if you get a fasting glucose with your doctor every year. And then it gets even worse in postmenopause unless you're doing something about it. So all of this can be exacerbated by toxic stress. Toxic stress can show up in your blood vessels. It can lead to microvascular problems, and it can also lead to plaque formation. And we've documented this pretty well in men, although not as well in women. Cognitive function can change, and we think a lot of this relates to toxic stress. So in premenopause, your cognitive performance stays relatively stable. If you're someone who's had a baby, you know that there's a little dip that happens. There's about a 2% loss of total brain volume after you have a baby related to pruning and new connections in your brain. But for the most part, in premenopause, your cognitive function is pretty stable. And then as you start to go through perimenopause, you may notice that your cognitive function declines, and toxic stress can make that worse. And that's documented in the studies that we mentioned. We also think that hormone therapy in people who are good candidates can be a really helpful way to mitigate some of the changes that happen in perimenopause, including your ability to cope with toxic stress. Toxic stress needs to be considered in a broader perspective. The way I think of it is that it can affect toxic stress can affect your hormones and your hormone regulation. It can certainly affect your sleep. It can affect the way that you use nutrients that you consume, the effect of your gut and how you're absorbing those nutrients. It can also affect your sympathetic activation, lead to excess sympathetic activation compared to parasympathetic, and it can lead to low vagal tone, low parasympathetic activity, less healing. It can also change your lifestyle behaviors. It can make you crave carbs more, to have higher cortisol levels. It can be influenced bidirectionally with social and environmental determinants of health. And all of these things can lead to immunometabolic dysfunction. And that can shorten your health span, the period of time that you feel toxic stress can increase immunometabolic dysfunction, and that can decrease your health span. I think of health span as the period of time that you feel relatively fantastic, free of disease. We want your health span to be as long as possible. And it can also lead to more age-related diseases, including cardiovascular disease, as we mentioned, cancer, diabetes, frailty, and sarcopenia, disability, both physical and also cognitive. And it can lead to early mortality. Women are especially vulnerable between the ages of 45 and 55 to toxic stress. We know that suicide reaches a peak in this period of time for women. It's in the setting usually of perimenopause, but we know that women are 3 times more likely to attempt suicide compared to men. Perimenopause is the greatest risk for women, so we need to be asking about it and talking about it. According to the research of Lisa Mosconi, there are these significant changes that occur in the female brain after 40. And I believe that toxic stress plays an important role. So she's found that as you transition from premenopause to perimenopause to postmenopause, using PET scans to measure the uptake of glucose, the brain's ability to use glucose starts to falter. And this is mostly a problem with the mitochondria. The thing that regulates your mitochondria is estrogen. And as estrogen first fluctuates wildly in perimenopause and then starts to decline, you get about a 30% reduction in the brain's ability to use glucose as fuel. So, one of the things that Lisa says is that if you look at the brain scans of men and women at midlife, say their 40s through their 60s, the women show more plaque, more brain atrophy, reduced connectivity, and reduced glucose metabolism. We should not think of dementia as a disease that starts in old age. We should think of it as a disease that starts in middle age. So, if you're someone who has got toxic stress, I just want to talk about some of the ways that it can show up, some of the ways that you could identify it. A lot of people don't relate to feeling stressed, but they do feel overwhelmed or they feel hypervigilant. They've got an exaggerated startle response. They feel anxiety. They have intrusive thoughts. They have insomnia. They have difficulty connecting with others. They have anger. They're easily triggered. They have negative thought patterns. They have self-sabotage, depression, difficulty with focus. They have cortisol that is measured and just doesn't seem to get better. It's either too high or too low or both within the same day. They have autoimmunity. They might even have dissociation, functional dissociation, where they go upstairs, they cognitively dissociate when something is difficult. They go beyond their window of tolerance and they start to think their way out of the situation. Some people have people pleasing or fawning as a way of demonstrating toxic stress. Some people have avoidance. That tends to be more common in men versus women, but women have it too. Or they may have other mental health issues. So there's many ways that toxic stress can show up, and I wonder if you relate to any of these particular issues. So I want to share with you one other case. This is a 52-year-old woman who came to me with new onset type 1 diabetes. And she had an autoimmune disease. She also had it in the setting of perimenopause and menopause. She had some difficulty with her blood levels of cholesterol. She was having lots of menopausal symptoms, hot flashes, night sweats, vaginal dryness, difficulty with sleep, anxiety, low sex drive, brain fog, fatigue, low energy. She felt like exercise wasn't making a difference for her. She had had a positive anti-nuclear antibody a few years before I saw her. And then she was suddenly diagnosed by her primary care doctor with type 1 diabetes. And it was related to autoimmune GAD65, which is a type of antibody that you can measure in people with type 1 diabetes. So as I started to talk to her about what was going on, she had a pretty good diet. She was pescatarian. She tried to keep things on the low carb side. She was doing some intermittent fasting. She was sleeping about 7 hours a night, but she wasn't tracking her sleep. But she woke up with poor energy, like a 7 out of 10. She had an ACE score of 9, so she had a lot of toxic stress in her body. She had had a root canal. She had 10 plus cavities. She drank about 1 serving of wine per week. She would walk 3 miles 3 times a week. She had no spiritual practice, but she had a high level of resiliency. She was a practicing lawyer with 3 kids. And so as we started to work together, what I found was that her cortisol levels were pretty low first thing in the morning. And so she would go from low, then she would have a cup of coffee, and that would spike her cortisol levels too high. And that's something I see a lot in my patients, that toxic stress shows up as cortisol in their saliva that's either too high or too low, or both within the same day. And if you're measuring cortisol in the saliva, which I think is the most accurate way to measure it, you can measure it at 4 or 5 times during the day, as I do with my patients, and you can see what the pattern is. So you're meant to have your highest cortisol within 30 to 60 minutes of waking up. And then it's supposed to gradually decline over the course of the day. And if that's not happening, you may find that your energy is not what it could be. So measuring your cortisol in your saliva can be really accurate. It was helpful in this woman. You can also measure it in your blood. But when you measure it in the blood, it tells you the total cortisol. It doesn't tell you the free level of cortisol. Salivary cortisol tells you free levels of cortisol. And that can be helpful because free cortisol is what's biologically available. The other thing that we did was to start her on a continuous glucose monitor. And it made a huge difference in terms of empowering her to be able to make choices with food that could help her reduce the amount of food stress she had, make her less spiky. And she went from having a really jagged, spiky glucose level over the course of the day to having pretty much a flat line. And that was much better for her body. It was less stressful, and it also was a way to reduce the damage that was happening to her blood vessels as a result of inflammation. So how do we measure trauma? You can do it with validated questionnaires. So I like the perceived stress test. You could take a look on Google, and maybe we'll link to it in the show notes. It's a really helpful validated questionnaire that was used in a lot of the studies performed at the University of California, San Francisco by Elizabeth Blackburn, looking at telomeres and looking at how women with a high level of stress were aging about 10 years faster than women with a normal amount of stress. You can also measure heart rate variability. So I measure heart rate variability in a few different ways. I measure it with an Oura ring. I use this all day, every day. I've been using this for years. And then I also have a device called 8 Sleep that measures my HRV with a mattress cover. You can measure your metabolic function, since that's related to toxic stress, like a fasting glucose and insulin, a 2-hour oral glucose challenge test, a hemoglobin A1C. You can look at the hypothalamic pituitary adrenal axis by measuring your serum level or blood level of cortisol. You can also measure cortisol in your saliva, in your urine, and even in your hair. You can also look at other sex hormones that are related to cortisol, such as your estrogen, your progesterone, your testosterone, your DHEA. So those are all the ways that you can measure toxic stress in the body. You can also look at it in the gut. So you can do a comprehensive stool analysis. You can look at the balance of microbes. You can look at the microbiome. You can look at function like intestinal permeability, so-called leaky gut, dysbiosis, secretory IgA, and other factors like calprotectin, lactoferrin, and gut structure, such as zonulin. One of the things that I see in some of my patients who've had toxic stress for a long period of time is that they have a flat cortisol pattern. So instead of spiking their cortisol first thing in the morning, which is called the cortisol awakening response, they're relatively flat. And some of them even have a higher cortisol level at night when they're trying to sleep. So if you're someone who struggles with your sleep, consider toxic stress, and you may want to measure your cortisol level before you go to bed. So what we know is that people who've got a flat cortisol pattern, those are the people who have the greatest risk of anxiety, depression, cardiovascular disease. If they have breast cancer, they've got a greater risk of mortality if their cortisol pattern is flat. We see this in post-traumatic stress disorder. And we also know that It seems to have the most dysregulating effect on your immune system and the development of inflammation. It can make it really hard to fight infections. It's worthwhile to talk for a moment about heart rate variability because it's so easy to measure. And if you're not measuring heart rate variability right now, I want to challenge you to start measuring it, because then you can start to do N of 1 experiments to see what works the best to help you with HRV. So, heart rate variability helps to reflect the balance between your sympathetic nervous system, fight, flight, freeze, fawn, and your parasympathetic nervous system, stay and play. What we know is that measuring it, even just for 2 minutes, can give you a lot of information. People who have reduced heart rate variability or low vagal tone have a greater risk of diabetes, cardiovascular disease, inflammation, obesity, post-traumatic stress disorder, as well as other psychiatric disorders. So what do we do? Those of us who've got toxic stress, what are some of the things that have been shown to help? So I went through to look at randomized trials, evidence-based solutions that could help us with toxic stress. And one of the most effective things is regular exercise. So that's really critical. Restorative sleep makes a big difference. So does meditation. So does yoga, qigong, trauma-sensitive, mindfulness-based stress reduction, nutritious whole food that doesn't stress your body, trauma-informed therapy, neurofeedback, EMDR. I think I should do a whole episode on EMDR. HRV training, strong social ties, and also psychedelic-assisted therapy. All of these things have been shown to help with toxic stress in randomized trials. Another technique that I talk about in my book, The Autoimmune Cure, is something called the neuro-emotional technique, or NET. And this is something that I learned about at Thomas Jefferson University because the chair of my department, Dr. Daniel Monti, performs NET, as do other practitioners at the Marcus Institute of Integrative Health. And the idea is that you can identify a neurological signature that the NET intervention can help you with. So I will tell you more about that in a future episode, but the idea with the research that we've done at Jefferson is that NET can help you make connections between the different parts of your brain, the prefrontal cortex, the cerebellum in the back, the amygdala, and can help to reduce autonomic reactivity that you might have in response to distressing memories. So you can change that signature in your body. Another area that I've done research on is orgasmic meditation as a way of dealing with toxic stress. And I feel like that deserves its own podcast as well. So, in terms of psychedelic medicine, what I think about with psychedelic medicine is that it creates these healing states of consciousness. And one of my colleagues, Brad Jacobs, is someone who coined this term, healing states of consciousness. The idea is that these are states that are transformative, healing, and evolutionary. You don't have to take psychedelics to achieve a healing state of consciousness. There's other ways to do it too, such as with holotropic states, holotropic breath work, shamanic rituals, intense experiences during spiritual or contemplative practices, experiential psychotherapy, near-death experiences, and just intense experiences in everyday life, as well as psychedelic experiences. So as we start to wrap up this episode about toxic stress, I hope that what you've learned is that we're wired to have a stressful experience not that often, maybe once a quarter, maybe once a month, max. We're not meant to have them every day or weekly. We're not meant to check our emails and get an alarm response when we check our emails. And so part of that alarm response is in the Pine network. It can affect your psyche, your immune system, your neurologic system, and your endocrine system. And with the endocrine system, the main hormone, with your endocrine system, the main hormone that gets affected is your cortisol. That's the primary stress hormone. So you can measure your cortisol level. You can do that in your saliva. You can do it in your blood. You can do it in your hair. You can do it in your urine. And a lot of these tests you can now order for yourself. You don't have to go through a clinician. It's important to realize that hormonal transitions like perimenopause and menopause can make toxic stress loom larger. And sometimes treating those transitions with lifestyle medicine or sometimes with bioidentical hormones can really help you cope with toxic stress in a better way. So I hope you have learned a little bit about toxic stress and how you might design some N-of-1 experiments, some self-experiments, so that you can improve your level of toxic stress in your body.